Hi, I'm Trevor with Trevor and Jill Talk with, of course, my wonderful co-host, Jill
That's
Fitzberg. We're sitting at a really interesting office today, and we're with Dr. Snowball and her daughter, Emma Robinson, and we have a lot to talk about, Jill.
They put together this wonderful practice that helps you look good and feel good, and it's really an integrative practice. And Dr. Snowball, your specialty has been in pain management.
It has,
which
yes.
I keep, when I was reading all the things on your website, I'm like, check, either for me or somebody very close to me.
Yeah.
So it's really interesting to hear.
Yeah.
And how did you two get started working together?
Oh, I guess from birth for me. No, I started. Well, my mom. It's interesting. My mom actually was in medical school for a lot of my childhood, so I
That's
always
amazing,
say
actually.
it's funny because I spend more time with her now probably than I ever did. But it's it was actually growing up with her and the way I was raised, because I was raised about being conscious. I still remember, don't head the ball when you play soccer. Don't pick up this with your back. It's always this awareness. So that was initially how everything kind of came about. And then we started here. I was more on the administrative side and helping out, and decided to go back to school and actually became a nurse. And so that was sort of how things ended up coming together, I would say.
And nurse practitioner school next year, finishing up.
Yeah, next year I'll be
We think that's awesome. And no mean feat to go to medical school while raising children.
That's
So very impressive.
Right. Yeah. It had challenging moments, but it was all worth it.
So, Dr. Snowball, you've been really involved in pain management in an integrative way, and especially today in this time of opioid addiction, et cetera. How did you approach that, and what's different?
Right. Well, I was looking for other ways to help people in pain and put together over time a program that involved first traditional medical treatment options and added non-traditional medical treatment options. Traditional being, injections, muscle injections, joint injections, physical therapy, and then the non-traditional strategies are yoga, massage, EPAT, and PRP. So we've blended that in our practice. We customize and individualize programs for particular pain needs in order to optimally lead to our outcomes. And I was looking for an alternative to offer my patients beyond use of medications, if it was possible. And opiates was part of that, yes?
So that's fantastic. So has that helped people to
It
leave
has.
some of the painkillers and go to?
It has. We've been successful in having patients discontinue opiate use. Sometimes it's still a challenge, and we have to treat the issue in different ways, but it's certainly effective in some situations when it's appropriate. Yep.
And are there some areas that you're treating more frequently than others that people are coming to for severe pain in which areas of the body, or is it joints, head, shoulders, knees, and toes? That's how I think
your whole body.
Yeah.
I think I have a large practice of patients who have neck pain. We fondly call that the tech neck, from texting, computers.
Because we're all looking down.
Yes, we're
It's
looking down. Yeah.
You have to
Add a little stress to your tech, and wow,
Exactly there.
That combo.
And then, oftentimes migraines are associated with that, so we treat migraines in the practice. For the lower body, though, low back is frequently thought to be the major culprit in lower body symptoms. I find often in my practice, again, is very busy dealing with what I call lumbopelvic back pain, which is not only back, but the role that the pelvis plays in that presentation. Sometimes it will be the hips, SI joints. Sometimes we do nerve blocks.
These injuries, say a football player who's now in his 50s is coming in and he was hurt from way back. Is this
Totally, yes,
athletic
totally
sort of
true.
things?
and one of those.
And even kids who play sports in high school,
Of course.
who are in a very competitive world and work very hard at it and injure themselves, and injure them sometimes in a way that they feel pain but are not sure what's sourcing the pain. And that's, it can be back, such as in gymnasts, or it can be hips, such as in the athletes that do a lot of running, the footballers, the baseball players, they tear their labrum in their hips. So there are diversity of problems. Even have one kid who's a water polo player and on the Olympics track and collided with another player, and for a couple months no one could figure out what the source of the pain was because he had negative x-rays and everything was negative, but when we imaged him with an MRI, he actually had fractured ribs. So we knew then why the pain was lingering for several weeks, and illustrating how sports injuries occur.
One of the things I think that she does that's really interesting and kind of unique is we talk about my grandfather. Her dad was actually an engineer, so she's always talked about the body. She always looks at it from an engineering standpoint. And when patients see her, what's funny is we have the paper on the table, and literally she is drawing out, this is connected here, this is causing that. And her patients say what happens is she's like a detective. She'll stay with them and just try and narrow down what that issue is, because a lot of times you might think it's your knee, but hey, it's not your knee, it's actually your back. It's, you know, the way you're
all
walking.
connected.
Absolutely, yeah.
Reminds me, what was that song we were little? But so now the two of you integrated another level, which is, Emma, right, you're into the cosmetics and other things that you can, again, bring joy.
Yes.
Right?
Different
so you make
kind.
you feel better.
Exactly.
Less pain.
Yeah, exactly. No, absolutely. So what I ended up doing is, the way that I kind of got into it was interesting is because with my mom, we do Botox for migraines, the muscle spasticity, things like that. And you'd see patients come back, I mean, with migraines on the dot the second it wore off because they were getting such benefits. So I ended up deciding to go back and train for the cosmetic uses of it. And from there, it sort of expanded. And what's been neat is now seeing this crossover with regenerative medicine, because you're healing, you know, tissue, skin. It's all the same thing. It's whether it looks bad or it hurts. You know, it's something
Hurts bad.
Yeah, it hurts bad.
So that's interesting. Regenerative medicine, saying it properly, and that it leads us to the EPAT. Is that right?
Yes, exactly.
So talk to us about that, because there's so many interesting applications. Correct?
Yes,
there are.
So explain exactly what
I
an
know.
EPAT is.
So it's a big word, extracorporeal pulse activation technology. Got it out. For short, EPAT. And it's high velocity sound waves, and you're literally bombarding the tissue very hard. It goes very deep, and what ends up happening?
Does it hurt?
Yeah, there is discomfort for sure. It's the second you stop, it stops hurting. It's while you're treating.
How long is a regular treatment for?
Depending on what the objective is. If it's for pain like a joint, typically that's 10 minutes.
10 minutes.
Treatment for cellulite would be longer. It's usually about 20 to 30 minutes.
And that's the timing is the delivery of pulses. So for soft tissue like foot pain resulting from plantar fasciitis, we deliver 4,000 pulses.
Let's talk about the plantar fasciitis. I was telling you before, I had this very badly. I did get over it after a lot of physical therapy. I used to wake up in the morning and feel like my foot was, I wanted to like pull it out almost. And there wasn't a lot of therapy for that. And I do know so many people, friends who are runners, marathon runners, older people who have this. So I'm sorry, I just wondering if you could say what this is,
absolutely,
how this addresses that.
Yeah, so we've treated people in the office who have plantar fasciitis, who have had injections, have had physical therapy, have gone through the gamut of traditional treatments, and are desperate for pain relief and present to the office. And we've treated them with plantar fasciitis with EPAT, and there's been resolution of their symptoms. It is amazing. It's thought to be a cure. Now, that's a big claim, but if their plantar fasciitis is sourcing, say, from flat feet, pronated feet, and using orthotics, then that's going to continue to fuel and drive the problem. So you might have resolution that may need some boosted treatments in the future.
So just to be clear, I'm just curious, plantar fasciitis, is it the muscle's not working, the muscle's tired, the muscle isn't strong enough? What is that?
It's the plantar fascia. So it's a sheet of tissue. Between muscle planes is white Kleenex-like tissue.
Okay.
It's like what you see on a chicken breast.
Yeah.
That's fascia.
And that attaches at the heel and covers the sole of the foot and attaches, travels toward the toes. And one of the presenting symptoms is a lot of pain at the heel. Sometimes it's over the sole of the foot as well. And if
First thing in the morning.
yes,
Talk to wear your heels.
Yeah.
and associated with that often is calf muscle pain, because the gastroc or the calf muscle, which travels to become the Achilles tendon, which we all know about, which then joins to the plantar fascia at the heel. So it's frequently back to the circuitry treatment, treating in circuit. So we treat the gastroc, the calf muscle, the Achilles tendon, and the sole of the foot when we're dealing with plantar fasciitis.
So when you use that EPAT and you're sending, what you said, 4,000 pulses per minute?
Yeah.
Something like that?
Yeah.
I'm not sure if it's quite a minute, but it's, yeah.
4,000.
Pulses,
You would-
period.
You would need how many of those treatments? Are those 10 minutes long and then you come back every week or every month? What would
Right,
the-
good question. It's, we do in the office 5 treatments weekly. Literature says 3 treatments weekly are adequate. I find that we found that if we did 5, we got better results. So we do that. And then you can always follow that treatment up with some more soft tissue mobilization, which can be massage or it can be ultrasound treatment and physical therapy, because the EPAT is actually encouraging blood flow into the area for healing. If you don't have blood flow to your heart, you have a heart attack. If you don't have it to your brain, you have a stroke. So it illustrates the importance of blood flow or perfusion to the end organ.
One of the ways I know that you've described it, which I think is very visual, is you think about a field, a barren field that's dry. You're essentially putting in more irrigation because you're having, there's new blood vessels that are getting to that area, so you're increasing that blood flow and the perfusion, like you were saying. But it's kind of, you think about from that standpoint and the difference when you've got more irrigation in the
Makes
field.
sense.
Yeah.
So is that covered by insurance?
Unfortunately, it's not. Yeah.
No, really, no.
I know.
It sounds like it's really working.
It is,
Especially when it comes to your foot or your
Yes.
joints.
Right. You would.
Now, there's another application,
Yes.
which some of us find very fascinating.
Exactly. So that's the treatment for cellulite. Now I say cellulite, but it's not actually directly affecting the cellulite. The way that it works is exactly the same with pain. You're increasing perfusion and blood flow, so you're actually strengthening and making the tissue, the connective tissue, healthier. So we all have those sort of spots on our body. Maybe some people don't. I feel like most of us do.
You're in there.
Yeah, and you just have those areas where it's the cellulite pushes through and it gives that bumpy appearance. So the way that EPAT works is you're tightening the connective tissue on the top, so you end up with a smoother appearance. It's not removing the cellulite so much, but making it look better.
So if you were to do that, how many treatments, or does
So
it
that's-
really varied on the person
No,
until
it's-
you really start to
I would
see?
So there's a couple things. One is that you do have to be the right candidate for it. I would say for somebody to come in, you do have to have, be relatively healthy, already exercising, eating well. It's more for people that have those funny little areas you just cannot get rid of. And for those treatments, you come in, it's about a 20-minute treatment. It's more than what you would do for a pain treatment. So it's twice a week for about 8 weeks. So you're talking 16 treatments. It's that would be, the challenge with it is it's slow. It's a lot of a time investment, but the results long term are incredible. So it's a matter of, it's not a quick fix, but it works so well.
So who cannot, there must be somebody that these treatments are not okay for,
So-
because that's always true with everything. So who would that
Right.
be?
If you're on anticoagulants, it's not going to be good for you because you're going to be at risk for bruising.
And for the foot as well.
For
This
anything.
applies to anything that you're using this
Yeah,
for.
because it's impacting the vessels. You're essentially causing trauma from the sound waves. The other thing would be pregnant. We wouldn't treat someone who's pregnant. And then finally, anyone with a pacemaker, we wouldn't do either. So those would be sort of the 3. But other than that, yeah, it's pretty, there's a good range depending on what you're treating. Like I said, for cellulite, it's a little bit more of a niche sort of people that work well for it. But
But I hear you have some really cool before and afters, which
yes,
we'll be seeing,
yes,
right?
amazing ones, yes.
And a demo too, we're gonna have.
Yes,
Which is
yes.
gonna be really interesting.
Right.
Exactly.
Yeah.
Well, this has been a wonderful conversation. I've learned so much. Thank you. This is great. Jill, anything else?
Well, I just, what are you treating a lot of people each week for the foot? Are you seeing a lot of people? Is there other applications as well for the EPAT?
There are. You can use it for the shoulder.
Mhm.
If you have a calcific tendonitis, that's calcium deposits on the rotator cuff tendon, which is very hard to resolve. and there are some quite complex procedures medically to deal with it, but the EPAT will deal with it. I had one example of a librarian who had developed a calcific tendonitis from pushing books over a scanner all day long.
Wow.
And he came for the EPAT treatment. We completed the series of 5. 3 months later, he went back for more. He wanted to do more imaging of the shoulder, and the radiologist, you could hear in his reading of the interpretation of the report of the x-ray of the shoulder, almost the incredulousness in his voice. It appears the calcific tendonitis has resorbed. Like he didn't believe it himself that it was gone because of the EPAT treatment.
The other one too would be elbow, golfer, tennis elbow. That's a big one. People get very, very good results with that.
That can be.
It's-
I mean, you can't even pick up a bottle. of
Yeah,
milk
I mean, it is. I will
sometimes.
say there's discomfort with that because you don't have a lot of padding in that area. It's like the foot in that sense. So, but the nice thing is we gauge the intensity. So if we never make it unbearable, but you do, there is some discomfort.
And you can sweep over the tender areas too. So if one is a hot spot, you can focus around the hot spot and just gently, quickly drift back over the hot spot for treatment. And it resolves as a sore spot very quickly during the treatment.
Well, anything non-invasive, right?
Yeah.
We're so supportive of that, right, Jill? Because
Right.
it's so tough when people go into surgeries and whatnot. You really don't know what the outcomes are going to be, and this sounds like a really nice alternative.
Right. That's a really good point. And a lot of athletes like this modality because there's no needles and no medication.
And maybe a lot less downtime.
Yes.
We all are so determined to be healthy, feel good, stay in shape, and it seems like there's always a little obstacle along the way
Right.
to keep you from that. So it's anything. I like this integrative approach.
Yes. Yeah.
So we have been so happy to be here with Dr. Snowball and Emma Robinson, and we're feeling good and looking good.
Thank